As the Ministry of Health continues its quest to inoculate 500,000 adults by the end of this year, it has announced that private hospitals have been permitted to operate as COVID-19 vaccination sites if they have adequate vaccinators, space, cold chain facilities, and arrangements for the management of possible adverse events. This disclosure was made by Minister of Health Dr. Frank Anthony during Thursday's daily COVID-19 update.
The Ministry would be providing the vaccines to these private institutions, and they in turn would administer the vaccine to their patients, to people who want the vaccine, who feel more comfortable going to a private institutions, to these private hospitals. And once they receive their vaccines there, the health staff of those hospitals would take the relevant clinical information that we need, and they would be able to issue the card that we are giving to show that people would have received their first dose.
Similar partnerships for an effective rollout of the COVID-19 jabs have been established by the Ministry of Health with non-governmental and faith-based organizations across the country.
And going to non-traditional places for health, so maybe a primary school or a community center or mandir or a mosque or a church. So we have been partnering with different agencies to do that.
At the moment, COVID-19 vaccines can only be imported into the country by the Ministry of Health. To date, more than 100,000 persons have been administered first doses of the Sinopharm AstraZeneca and Sputnik V vaccines. None of the vaccines offer 100% protection against the virus. It is therefore important that vaccine recipients continue to wear masks, wash hands, and sanitize. A person is considered to be fully vaccinated 7 days after receiving their second dose of a COVID-19 vaccine. Recipients of the first dose who become infected with the virus will have to first recover before the booster dose is administered. Temika Rodney reporting for the HGP Nightly News.